Dr. Ireifej here, veterinary surgeon, owner of Vet Triage, the one and only veterinary telemedicine company of its kind, spearheading a movement. Happy Veterinary Technician Week. Fantastic. Well deserved. We're going to go over some stats in this video, and we're going to outline what a 2016 survey showed that veterinary technicians were saying, where the problems are in the profession, and where we can move forward. Hope you enjoyed this, and I'm sure this will probably resonate with a lot of veterinary technicians out there because this is not a new thing. So we've got about 80% of veterinary technicians are actually accredited, and not every state requires technicians who are actually accredited or licensed, but the majority do, and typically that's good. It requires more education, obviously, more skill set, and of course better pay. In fact, about 80%, 85% of technicians also have an associate's degree or a bachelor's degree, which is also great. That's very different than when I used to practice veterinary medicine back in the day. Usually you just had to just apply, and you'd be a veterinary technician. So it's nice that a lot of the veterinary technicians, the majority, are actually well-educated people. That means that they are choosing a profession knowing that the financial rewards may not be as high as other professions that they can easily go into, but they love the pets so much, the animals so much, that they're willing to actually go ahead, take a relatively speaking a pay cut, and do this great work. So everybody knows that veterinary technicians are literally the backbone of a veterinary clinic. Literally, they can do everything. They do veterinary technician work. They're in the operating room. They do anesthesia. They even do invoices, billing. They'll do discharge instructions. They'll discharge patients, answer client questions, show clients how to give medications, give transfusions, do CPR, everything. And not only that, a lot of times their jobs end up blending into other people's positions at the clinic too. They'll do reception work. They'll answer the phones. They'll manage people. They'll work on schedules. Fantastic. So everyone knows this. The internet is just flooded with just how amazing technicians are, and we absolutely value every bit of them and what they offer to the practice. The vast majority of veterinary technicians, well over 50%, work in companion animal medicine. A small subset work in specialty, about 11%. Another 11% work in emergency practice. So well over 50% work in that sector of veterinary medicine. You don't see as many in the large animal, the mixed animal, the exotics, that sort of thing. And that makes sense. The small animal business is always booming. That's just how it is. That's the nature of what we're working with here. It used to be, actually, in 2012, the average technician age was 40 years old. Still 95% female. It's always been much more, the males have always been greatly outnumbered by females in the veterinary technician world. But it used to be 40-year-olds on average. Now we're looking at somewhere around 20 to 30 years old. So that's interesting too. And I think it has something to do with the newer generations, with the rise in veganism, vegetarianism, animal rights, and of course a lot of times a lot of these folks too from this younger generation are also more motivated by having sort of a greater, I would say, ideology when it comes to helping animals. And so they're willing to have a tougher professional quality of life, take a pay cut, work long hours in really stressful environments to help the pets they love. So for them, it's worth it, and that, of course, is obviously very appreciated. We've got, what other stats here? The work hours. So the majority, 75% of them work somewhere between 30 and 50 hours a week. So, and I'm surprised that number, actually. I think it's actually way lower than what it really is, but that's what the stats say, at least based on this survey. I know technicians work hours beyond their shift, which is something that we need to change. They typically get paid somewhere between $14 and $20 an hour, and then it caps there. And that's one of the problems we have to deal with. So not only do we have to figure out ways to make their work week more efficient so that they start work on time and leave work on time, we need to find a way to pay them more because there's a ceiling. And just to some degree, yeah, their skill set gets maxed out after a certain while because they end up learning the majority we need to learn to run a veterinary clinic. There are the poverty line in the United States is considered just under $30,000 a year. So do the math. They're not making that great of a pay, considering how much we depend on them as veterinary leaders in the field and how important they are to a veterinary clinic. So we need to work on being able to pay them. We also need to work on more benefits. They don't all get all the benefits you'd want out of a job, like retirement and buying into a company and CE, continuing education time, sick days, paid vacation, raises. They don't all get that equally across the field, and so that's a problem that has to be mended with, or else we're going to end up running out of veterinary technicians, and that's part of what I want to talk about as well as a shortage. We've been seeing a shortage of veterinarians. We can't seem to find them, and so I think that speaks to the chronic negative cultural influences we've had in the veterinary practice. We have not been listening to them, even though we know there are problems. Let's see what else we have here from these stats. Oh, so they actually have the top 6 problems that veterinary technicians have reported. Low incomes, we already discussed that. Burnout, yeah, they burn out. They're understaffed, and the staff that they do have, there's always this interpersonal uncomfortableness. There's always this friction between individuals, between the front of the hospital and the back of the hospital, between technicians and assistants, between technicians and doctors, between technicians and managerial staff. They literally are the center of all of this, and so they get all of that. And so between doing their own jobs and dealing with the dynamics, they get burnt out. Lack of recognition is concern number 3. Yeah, we say we value them. We do this veterinary technician week. Yay, maybe you have a system in place where they get bonuses or raises, but not really. Again, they get capped at some point. And I can tell you, veterinary technicians don't get as much recognition from the standpoint of being rewarded financially by their practice owners. They just don't, and they need to be for those who deserve it. Likewise, there also needs to be a system of accountability too for technicians. If they're not doing the appropriate work, or anybody in the facility is not doing the appropriate work, then they need to be told that, and then that has to be remedied. So that plays a role in this lack of recognition. The other part of it is, and this is also one of their 6 points here, is underutilization of skills. A lot of them know way more than they're actually used for. And the ones who've been doing this for a long time and are really good at it, they have nowhere to go educationally speaking. We need to send them to more continuing education and not penalize them for it. They shouldn't have to use vacation time for that, and they shouldn't have to pay money to go do that. Continuing education should be part of the deal, so we can get them learning new stuff and then bring that information to the practice. Likewise, internally, the veterinary technicians who are most experienced, who are really good at their jobs, should be able to, maybe for more compensation, should teach other technicians, other veterinary assistants, even other veterinarians, what the newest and latest is. Give in-house lectures, give wet labs, dry labs, seminars. These are all things they can do. So we've got low income, burnout, lack of recognition, lack of career advancement. We already mentioned that. There's a cap to what you can pay them. And let's say, for example, you want to promote a technician to become a manager of something, manager of technicians or assistants or whatever, supervisor of somebody, some group of people in the hospital. Well, then usually it takes them away from the animals and the clients, which is why they're doing this in the first place. So we either have to pay them more but change their title and, of course, change their job description, or they stay doing the same thing for years and years and years. They don't get compensated for it. They don't learn anymore. They don't grow anymore. And they're actually asking for growth, asking for more responsibility. So we need to figure out a way to do that. And I think one way to do that is provide them with actual assistants, veterinary assistants. They actually have degrees in being veterinary assistants. You can actually go to school for that and get a degree in being an assistant. Give them help that actually is worth something to them. Spending less time in a medical record writing things down, or on a computer typing up the medical record. The veterinary technician should be with the patient and with the client, mostly with the patient. And their veterinary assistant should be able to do things for them that the veterinary technician can do but doesn't have the time to. So let's figure out those things. Let's have liaisons or customer service people that provide an in-between to help the technicians out. There are ways to do this where we can improve the quality of life, professionally speaking, for veterinary technicians, and improve the quality of medicine for them. So there's ways to do that. And then finally, competition with on-the-job trained technicians. This goes back to my earlier point. It used to be that if you want to become a technician, this is how I learned. You start off as an assistant, you learn enough stuff, and you become a technician. That's how it is. Now, there's competition. You can have a technician who's not accredited, not licensed, but has been doing that job for 15, 20 years in that hospital setting. Meanwhile, have a graduate from a technician school who jumps in, who maybe is less experienced but is accredited, they're not going to get paid as much as the experienced person. Their skill set is not going to grow as much because they just started after graduation. And there's competition there, heads butt, because now you have I'm accredited, that should be worth something. I just spent thousands on schooling. And then you have the technician who's not accredited, but who's been there for 20 years, who's like, well, I've been here more and I know more than you do. And both are right. So there needs to be some way to try and minimize that competition, or at least eliminate it ideally. So top 6 concerns that technicians have based on this report from 2016 are low incomes, burnout, lack of recognition, lack of career advancement, underutilization of skills, and competition with on-the-job trained technicians. Compassion fatigue makes up 70%. 70% undergo compassion fatigue, but only 23% get support at the hospital. We need to either figure out a way to restructure those clinics to make it where this is their focus, or hire somebody from the outside who's trained with emotional intelligence and collegial work environment. Pay the person whose job it is to do this, and find ways to improve this culture, because that's not good. 70% compassion fatigue, but only 23% get help. It's not good. 45% of technicians say that they would actually benefit from having more staff, and that's standard everywhere. You should have per doctor somewhere around 4 technicians per doctor. That's a lot of technicians, and we already are seeing a shortage of it because the culture has been so bad over so many years and not getting any better that it's hard to hire technicians. It's also hard to hire doctors. And so we focus on hiring doctors so much that we forget that those doctors need support to get the job done. They can't do all the things that a technician can do. They can physically, but not temporally. So we need to improve the quality of life of technicians, so they want to work for us, that they're easier to find. They'll tell their technician friends at conferences or just in town, hey, this place is great to work. They compensate you, they listen to you, they value you, they want you to learn more. They support collegial work environment, all that good stuff, and you'll get more technicians. We as veterinarians have to stop cutting corners of trying to pay people, either hire as little as possible to the job of triple the amount of people, or figure out ways to not pay them. You have to pay them. There's just no way around it. Overall, technicians, about 75% or more, actually say that they're happy with the profession and they don't plan or rarely plan on leaving. And that's interesting considering all the complaints that we just went through. So I think that this goes back to the very beginning, and then I'll end here, that veterinary technicians are absolutely amazing. They love what they do, and they don't want to leave. Despite all this abuse and lack of solutions over the past 20 years, they still stay and still enjoy the job. And so it just speaks to their ethics, speaks to their work diligence, and we applaud them for that during Veterinary Technician Week. There's many, many more things that need to be changed, and I urge veterinary technicians to speak up, start a coalition if you have to, beyond a Facebook chat group or whatever else. Start an actual coalition to work with organizations that are supposed to be looking out for you. And the National Association of Veterinary Technicians in America, NAVTA, are the ones that I found the survey from, and you guys need to speak up. And if you need a veterinarian to represent you, I'm your guy. So let's get this going. Again, thank you so much, veterinary technicians, for doing everything that you do, for being basically the veterinary nurse equivalent of the human side, and we applaud you. Absolutely fantastic work. Nobody compares to you, but there's way more improvement that has to be done to make your job quality go up and up and up, so that we can supply more clients, more pets with your amazing care. This is Dr. Shadi Ireifej from Vet Triage. I thank you so much for listening, and we'll see you next time. Take care.